Hi everyone, I'm Shannon. I'm a family nurse practitioner, and today's video is going to be about exercise throughout pregnancy. I'm currently 23 weeks pregnant, and I've been modifying my exercise routine to fit my pregnancy and how I've been feeling. One of the important things to note about exercise in pregnancy is that it's encouraged and it's actually considered safe for uncomplicated pregnancies. The list of benefits for doing exercise throughout your pregnancy is just exponential. It can reduce the risk of depression, it can reduce excessive weight gain, gestational diabetes, large for gestational age babies, preeclampsia, and can also reduce a lot of common back pains and pelvic pains associated with pregnancy. Now, the goal is for a modified exercise routine that is safe for both you and the baby. This is going to exclude contact sports, exercises that involve jumping or cycling. If you were doing pre-pregnancy exercises with moderate to high intensity, such as aerobics or jogging, these can be modified to fit your pregnancy. The goal of exercise in pregnancy is to reach approximately 150 minutes per week, or about 30 minutes per day, 5 days a week. And you want to make sure that you're stretching both before and after your workouts. Now, if you weren't exercising regularly before you were pregnant, it's okay. You can still do a modified exercise routine. You can start with 10 to 15 minutes per day and work your way up until you've reached the exercise goal and as you feel comfortable. So some exercises that are considered pretty safe throughout pregnancy are yoga. However, you want to avoid hot yoga as it can lead to dehydration. Stationary cycling is also considered safe in pregnancy. Brisk walking is a great way to get your heart rate up and get yourself outside, get some sunlight during your pregnancy. You can also do low resistant weight training with about 10-pound weights and just modify by increasing the intervals that you're doing rather than the weights. Now, my personal routine throughout pregnancy has been a mix of doing yoga when I can get it in. I have a 2-year-old son, so it's sometimes hard to fit in workouts. However, we do live in a very walkable community outside of New York City, so we get outside quite a bit. I'm walking pretty much everywhere. I make sure I'm getting my heart rate up and that I get at least 10,000 steps per day. One of the most important things to keep in mind when you're exercising throughout your pregnancy is that you're more prone to dehydration. Pregnant women need more water in general. The recommended amount is 8 to 10 glasses of water per day. And when you're exercising, you want to make sure that you're hydrating both before, during, and after your routine. Okay, now reasons to stop and call your doctor is if you experience any of the following. If you start to have vaginal bleeding, leaking of fluids, contractions, dizziness, headache, chest pain, or difficulty breathing that's outside the norm of exercising, you need to contact your provider and possibly seek help, as these are serious medical conditions in pregnancy. Of course, if you have any questions about pregnancy and exercising and what's safe for you based on your risks, please talk to your provider and they can give you suggestions of exercises that you can do throughout your pregnancy. With that, I want to say happy exercising, and if there's any pregnancy exercises you've been doing, please leave a comment below. I'd love to hear what everyone else is doing. I'll be posting more videos addressing medical questions that a lot of parents may have, and I hope to bring more knowledge to this community, and I would really appreciate your support. Thank you so much. I'll see you next time.